Yeah, sleep apnea is just for those that don't know, they hear the term but they don't know it. There's a couple different types, but primarily we talk about obstructive sleep apnea. So that first word, obstructive, means that something's getting blocked. And so essentially, if somebody has an airway that's getting smaller but not blocked, they'll start snoring. If it blocks all the way, that's apnea. So historically, apnea has been treated one of two ways, which was surgically to cut away the tissue in the throat. 50% recurrence rate, never any fun. Nobody really wanted to do that, but that was one tool. And the second tool is a CPAP, which is basically a compressed air being forced into your lungs, and that opens up the airway. Whether you want it open or not, it's going to be open with the pressure of that. And for many people, that's the best treatment in the world. The unfortunate part about CPAP is that there are a lot of people that just can't get used to it. And so it gets tabled, and therefore it's not doing them any good because they don't use it. So 3 or 4 years ago, the Medical Society turned to the Dental Society and said, well, there is a third way, which is if we could make an appliance that would take the lower jaw and move it forward, change the jaw position, change the tongue position, we can open up that airway, allow people to breathe, and avoid the other two. Can you as dentists help us out? Because we don't work with plastic, we don't work with teeth, we don't work with jaws and muscles. And so in the last 3 or 4 years, there's been just this slow growth, but it's just a tremendously valuable service to the whole medical community of how dentists are helping out with sleep apnea by making these mouth appliances that are basically like a retainer that you wear. They're very easy to wear, and they're very successful.